I also warmly congratulate my noble friend Lord Crisp, not only on securing this debate and his comprehensive introduction, but also his phenomenal commitment to the Nursing Now campaign and the Triple Impact report, so very ably assisted by my noble friend Baroness Watkins of Tavistock. My Lords, I must declare an interest as an Honorary Vice President of the Royal College of Nursing, the RCN, and the privilege of being involved in the work for the Triple Impact report. It is, of course, many years since I was registered to practice in the UK, but I maintain a passionate commitment to nursing, especially through my involvement with my small NGO, Humanitarian Aid Relief Trust, or HART. HART was established to provide aid and advocacy for people suffering oppression, often in conflict or post-conflict regions not reached by major aid organisations for security or political reasons. We work with local partners. We always give them the dignity of choice, asking them to identify their priorities for aid, and these are often the provision of healthcare in very challenging situations. Time only permits me just to give two examples to illustrate the achievements of nursing in such challenging situations. First, in northern Uganda, while the notorious rebel Lord's Resistance Army was still inflicting its reign of terror, we in HART visited and established a partnership with local people desperate to help orphans for whom there was no one to provide care. A key professional was the senior nurse, Pius. In addition to providing clinical care for orphans, including those with HIV, he also runs the local clinic, where he's confronted with massive clinical challenges, such as an 8-month pregnant lady with cerebral malaria. In the rainy season, the nearest hospital is 40 kilometres away and inaccessible. Pius therefore carries full clinical responsibility in that area. When we invited a medical colleague with special interest in tropical diseases to sit with Pius for a clinic, he said that Pius's work was superb, it could not be better. And that initial programme has grown from over 10 years from care for 39 orphans to provision of holistic, nurse-led healthcare for over 600 HIV-positive children and their families. Second brief example, the little historically known Armenian enclave of Nagorno-Karabakh, subjected to attempted ethnic cleansing by Azerbaijan in the early 1990s, gained a ceasefire in 1994. When we asked them for their aid priorities, the government identified help for people with disabilities, as there was no effective provision in the former Soviet Union, where disability was still massively stigmatised. Our partner Vardan was given a bomb-damaged building from which he developed what is now an internationally recognised centre of excellence, staffed by nurses. The member of his nursing staff responsible for treatment of pressure sores initially had to contend with horrific cases. One patient with fungating sores was suicidal. Marietta treated him so successfully he recovered, making exquisite wood carvings, achieving self-esteem, financial provision for his family, and happiness. These examples illustrate the competence and achievement of so many nurses. I could give so many other examples, working in very challenging situations in remote areas, sometimes in conflict or post-conflict situations, whose achievements we celebrate, perhaps particularly appropriately today, on International Nurses' Day. I therefore also greatly appreciate the work of the Royal College of Nursing, the RCN, with its support for and participation in a number of nursing alliances in Europe and the Commonwealth, which not only seek to influence European and global policy, but also to spread learning and experience between nursing organisations. For example, the development of advanced practice on nurses' key role in tackling antimicrobial resistance and addressing the health of the health workforce. One example is RCN cooperation with the Zambian Union of Nursing Organisation on their implementation of the WHO Safe Surgery Checklist and raising the profile of the profession in Zambia. This work and their visibility as an organisation that seeks to improve practice means they are increasingly a partner of choice for the Zambian Ministry of Health. It has also helped them to build their own membership as a professional nursing association as well as a trade union. My Lords, the RCN also provided background to the Nursing Now campaign by undertaking research on key trends in nursing and identifying the areas that make a significant difference to nurses being able to achieve positive changes for health, including education, professional regulation, workforce resources, a pleasant working environment, and nurses' ability to influence and improve health policy. And the RCN is committed to continue to raise the profile of this significant and global initiative. My Lords, I'm delighted that the Triple Impact Report and the Nursing Now initiatives have helped to highlight the fundamental importance of nursing here in the UK as well as in developing countries, where they are often the only providers of healthcare for large populations. As I've indicated, I've seen many inspirational examples of nursing practice in remote and very challenging situations, and I hope there'll be greater opportunity for a two-way programme of professional visits for nurses from those areas to come to the UK to benefit from clinical updating and latest developments, and for UK nurses to visit their colleagues in those remote situations where they will benefit from the inspirational resourcefulness and professional competencies of colleagues. May I therefore conclude by asking the Noble Lord the Minister if Her Majesty's Government will provide adequate support for these two-way professional training programmes which will help nursing, as the primary provider of healthcare around the world, to continue its vital contribution to the well-being of people globally.